Hello, my name is Dr. Trent Davidson. I'm one of the dentists here at Mindset Dental. I want to talk about what it's going to be like to have a tooth removed under twilight sedation and what to expect afterwards, and a few rules just to make sure everything heals well. Now, when you do come in on the day of the twilight sedation, you'll meet our anaesthetist, and together we'll go into the room, and there will be one needle that our anaesthetist will need to put in your arm, sometimes your hand, sometimes your foot, depending on where the anaesthetist best thinks it will go. And then you'll start to feel a little bit sleepy. And the idea of twilight sedation is to make you as comfortable as possible so the procedure is safe but comfortable. And often that means that you won't have any memory of any dental work. Often it will mean you'll be fully asleep. But sometimes there are situations where the anaesthetist needs to make sure that you're safe, and so it doesn't put you into as deeper level of sedation, which means sometimes you are aware of certain things, but it doesn't bother you. It's a very strange sensation. And when you wake up, you might be able to say, yeah, I remember you touching my tooth, but I remember it wasn't a problem. Now, as far as the dental work goes, I would need to numb that area up. I would need to remove the tooth, but you're not going to be worried about that at all. You'll be asleep. When you do wake up, you will feel numb. And that's normal. That's the way I want you to feel. You won't look any different. It will just feel a little bit strange for a few hours. And then, to make sure everything heals well afterwards, there's a few important rules. The first rule is I want you to do a little bit more chopping than chewing over the next few days, and try to use the other side of your mouth if possible. If we're removing multiple teeth on both sides of your mouth, just try to stick to foods like yogurts, soups, ice creams, that sort of thing, just until you get the hang of everything, and then you'll gradually increase the hardness and difficult foods, and eventually you'll just be back to normal and everything will be okay. Rule number 2 is I don't want you to drink any alcohol for 24 hours, and rule number 3 is I don't want you to smoke for 24 hours as well. Follow those couple of rules and you'll be completely fine. As far as pain goes, when the numbing wears off, it will be a bit sore. I'm not going to lie. It'll be a bit sore that day, the next day, the following day, sometimes even up to a week or two. But what we want is for the pain to be getting better day by day. If the pain does get better, but then it starts to get worse, give us a call. Sometimes it's just a matter of popping a little bit of gel in that area and the pain goes away again. That's something we call dry socket. If you need any pain medication, often Nurofen or ibuprofen is your best bet. Sometimes people can't take ibuprofen because they have gut issues. That's where you can then take paracetamol or Panadol. If you don't have gut issues and you feel like the pain is quite bad, take the Nurofen and the Panadol together, and that's the best thing you can have after we remove a tooth. And I do expect that you'll need painkillers for at least a couple of days just to make sure you're comfortable, especially before you go to sleep at night, because when you can get a good night's sleep, you can conquer the world. As far as bleeding goes, when you leave here on the day, it won't be bleeding. It'll all be looking good, but it will ooze a bit for a couple of hours. And what I mean by ooze is you'll almost be able to taste something a little bit metallic because your tongue's right next to the area, but that's normal. Or your saliva might be a tiny bit pink, but it will be 99% saliva, 1% blood. So try not to worry about it too much. You can just swallow it or gently spit it out. If you are worried about the bleeding, I'm going to give you some little bits of sterile gauze. I want you to put a little bit where the tooth has been removed and bite onto it hard for about 10 minutes, and just the pressure of biting will stop any last of the bleeding. Now, we've talked about bleeding, we've talked about pain, we've talked about making sure things are healing well. I will give you an instruction sheet on the day with a whole bunch of different instructions. Everything I've mentioned today is on here. If you only remember a few things though, just try to be gentle on that area and make sure you have some food before you come in, if possible. I know with IV sedation, sometimes you have to fast for a little while, and that's where you can eat afterwards, but try to do a little bit more chopping than chewing. And I do also want you to know that even though you will have some sedation, you will still be in control the whole time. And if you need us for anything, even after the appointment, send us an email, give us a phone call. We're always here to help.